Hi, I'm Damon Davis here in the HHS Idea Lab. It's an exciting time for the Department of Health and Human Services. It's almost time for Health Datapalooza 2016. Today I have in the lab with me Josh Rosenthal. He is the co-founder and chief science officer for a company called RowdMap. RowdMap is a prolific user of HHS data. There's a lot of data available on healthdata.gov. And Josh, the serial entrepreneur that he is, has been making very good use of that data, trying to help the provider practices around the nation make a transition between paying for volume of care to paying for quality of care, and helping them with the strategic decisions that go along with that transition. So Josh, welcome. Thanks for joining me today. I was going to ask you, year on year, we see some of our great, most data geekiest friends at the Health Datapalooza time and time again. Yeah. What do you think is the driver for folks just continually coming back to this conference year over year?
Yeah, I mean, part of it, kind of simply put, there's more and more stuff there, right? There's more and more data coming on site, and the ability to be able to connect kind of CMS prescription to FDA, to social services and CDC is really interesting. But honestly, there's a trajectory to the whole thing. I mean, early on, it was sort of a vision. We're going to put this data out there and see what happens. And it was this position of humility, really, to say, we think that the market can, you can have 1,000 flowers bloom rather than us try to create something better. And that was kind of crazy. And then year 2 and 3, you wanted to see if people adopted it, right? Did people actually get in and play with it? Would the data producers continuing to produce it? And then now that we're into year 4 and 5, there's a bit of a turn where, can we actually create value out of this? Like, is this more than just kind of rah-rah and yay for us and we're doing something? Do we actually see kind of outcomes? Do we actually see companies being able to create value in the marketplace around it? Do we see communities be able to use the data to solve their own problems? So throughout the past few years, there's been this building trajectory that we've been moving up into, and you can call it, kind of a transition from adolescence to maturity in a bit. And I think that's a big draw, at least for us, to say, hey, there's the promise of complete disintermediation and radicalization of some of the data assets out there. Is anything going to come of this? Okay, now the market's adopting it. Now specifically, how can this help? Can this prevent risk? Can this prevent breaches? Can this supplement in an era where all the insurers are losing their shorts because they can't risk adjust and their actuarial models are broken? Because in commercial, their business is turned every 3 years. Now in government programs where their stock is driven from, it's turning every year. Can this public data, CMS or otherwise, essentially reinvent their core models? So now that we're really getting to the meat of it and connecting it to the value propositions, whether it's providers going in to pay for value or payers being able to calibrate and project risk more accurately, it's opening up these other additional worlds. And just intellectually, you sort of want to play where you can make an impact. Making another widget isn't the most interesting thing.
Agreed.
You want to be able to change someone's life fundamentally, and you want to be able to do it in a complex system, right? It's really easy, honestly, to make money doing bad things. I have like 1,000 ideas a day. My partners keep me out doing that. And it's really easy to do good things and be unprofitable and just file 501c3. But the trick is, can you help people and do public and social good while you create a value proposition in the market? And the public data is stunning at that. It is completely stunning. And the challenge has been, there's kind of a high bar to sort of get into it on the backside and understand not just how to work with the data, but the business piece around it. The college kids, it's not like you can just whip up an app and put it out in the iStore and have that happen. And on the bigger status quo side, some of this stuff may disintermediate some of the larger legacy systems. And so the question is, how can you slowly introduce this to the market in a meaningful way? And Health Datapalooza is pretty interesting because it has all of those vectors there. You have the policy, you have the investment, you have the data, and you have the business, and you have the new folks coming in, which are potentially disrupting, and the status quo folks, which are interested in innovating around new products and services. So it's a unique mix, and then to your point, that whole thing has been building, where we've gone from novelty to adolescence, and now we're getting into meaningful value propositions.
Yeah.
So.